Wagwan, welcome back to my channel. I am Natalie, and today I just want to talk about the importance of taking your medication. So for me as a dialysis patient, over the years I've been on phosphorus binders, calcium tablets, and sometimes Tums, which is also a kind of blend between phosphorus and calcium. If you ask me, it's really a calcium tablet, and of course sometimes the steroids for my lupus to control whatever is happening there, but I haven't been on that for quite a bit, like sustain, so depending on what's going on, if I'm really things are happening, then they might put me on it for a while and so forth. But two things that I take as a dialysis patient, well, three things: medication for my hypertension, that's one. The phosphorus binder, which is known as renella or Savelama, is the drug name, Savelama 800 milligram, and of course 1-alpha or alphacalcidol, which is a calcium tablet. I should get them. Let me show them to you. Alrighty, so I was gonna start over the video, but no. So I forgot this one, which is folic acid, right? Folic acid, which you take once daily, which is to help with the absorption of iron. And remember that you take those iron injections when you're on the machine. Some people might be Mircera, some people might be Recormon, and well, Mircera or Venofer, and for most of us Recormon, because Recormon is kind of a short dose thing where you take mostly with dialysis sessions. The Mircera is more long acting, as well as the Venofer, so you may see that recommended once a month or twice a month, right? Then you have, so I showed you the folic acid, right, which is to help with the absorption of iron. This is the 1-alpha or alphacalcidol, right? See, name Natalie Legore, and it gives you my dosage on it, how much I'm supposed to take, and the amount you take is dependent on what's happening with your parathyroid hormones. Remember, two of those glands that I removed with this surgery. So that's what this controls. It regulates your parathyroid glands, regulates your hormones. It is important to take this and keep your parathyroid levels within the normal limits that are prescribed for dialysis patients, which I think is between 300 to 600, right? So these are calcium tablets. It's a kind of it's literally not even calcium and vitamin D, right? It's calcium and vitamin D, because your kidneys produce a form of vitamin D that I don't think would be replicated so much in your food, and hence the reason for this, for the 1-alpha, right? And as I said, the drug name is alphacalcidol. Alphacalcidol, right? It's important to take these things because you don't want to end up with this surgery. Apart from doing the surgery, is that one of the things that happens when your vitamin D levels and calcium levels are out of whack is that you get a lot of joint pain, a lot of bone pain, because it can lead to osteoporosis. Hear what I'm telling you, it can lead. There was a time when my PTH levels were so high before I did the surgery that I couldn't even wear a pair of high heel shoes because it was so bad. The pain level in my feet, when you walk, your heels, your ankle, you can't, when you lay down, you're feeling your hip bone, you're feeling your knees. It is just a very painful experience. Your shoulder joints, it's like pain all over. So I would suggest learning your medication and understanding why it's important to take it, right? Doesn't mean it won't happen, but what happens with a lot of us is we're on the medication, we're not checking to see if anything has changed in our bodies, which means checking in with our doctors. I don't practice to go and see my doctor every 2 seconds, but the reality is if anything shifts in my body and I notice it, I'm the first one to reach into the doctor's office because I'm going to want to find out, let us see where I'm at and what is happening. So I don't ignore the signals that my body is sending me, and that's something you have to be aware of as well. So you have the folic acid, you have the 1-alpha, and then you have the renella, right? And as I said, the drug name is sevelamer. See it at the bottom? Sevelamer, right? Sevelamer, right? And this one is a phosphorus binder. It's important to take this because the dialysis process does not remove phosphorus from the body. And what happens with phosphorus is that if phosphorus builds up in your body, that too can lead to bone issues and bone density issues. And you don't want that. And if you ever see a dialysis patient that's constantly itching, chances are their phosphorus levels are high, right? So that's one of the reasons. And these two work together. They really do. Because you'll find is that if you don't control this, it affects this. And if you don't control this, it possibly affects that. That's my experience. So that is thing. This too, calcium carbonate, or as you know it, Tums, right? The Tums is used to also help to protect your stomach before you eat, but also to help with your calcium levels. So when the doctor tells you to take it half an hour before your meal, I don't think as a dialysis patient it's so unreasonable or unfair to say to you, schedule your meals and take the damn tablet half an hour before you eat. It's important because you don't want to end up with gastrointestinal issues. You don't want to end up with stomach issues, constantly putting these medications down your throat, down your stomach. Someone will take in the medication and you have not protected your stomach. No food, no Tums, no nothing. And not everybody uses Tums. Some people may use omeprazole. That's one of them that they give you as well to protect and coat your stomach. So take your medication. So for me, I am hypertensive. So I also take what they call nifedipine. You may see this brand from the hospital, right? Nifedipine retard, what they say? Carditis retard, nifedipine extended, right? And sometimes you may see this one. So again, you see the Calcigard. So this one said Carditas. This one, I guess, is a different brands, but the drug is nifedipine, right? Oh, I'm holding it upside down. Right? So the drug is nifedipine. So these are for people, I don't know, they have all kind of different hypertensive medications. These are the ones that I take. I'm not telling you to go and take these things if your doctors, if you're a nephrologist, have not put you on them, okay? It's what is recommended for you. I'm just telling you what these medications mean to me and why it's important for you to take your medication. Because if you don't control that blood pressure, it can lead to heart attack, it can lead to stroke, okay? If you don't take the phosphorus, if you're on phosphorus, some people may not need to, is that you can end up with bone issues in the long run. Same thing with the active form of vitamin D and calcium mixed together, the 1-alpha. And it's important for you to know these medications because you need to know what you're putting in your stomach. Because I've literally had people tell me that the sevelamer is to control your potassium. Oh no, it doesn't. It does not control your potassium. It's a phosphorus binder. And I go Google just to show you all of you because I know some people might be doubting me, but I think by now you must realize that I'm very invested in this thing. It doesn't mean I know everything. It doesn't mean I definitely don't know more than the doctors and the healthcare professionals, but I do know what happens with my body, right? That I know better than the doctors and the healthcare professionals. And I do know how I interact with my medication because I pay attention to them. And I pay attention and I read about them, right? Renella uses. Renella uses. Can you see what it says there? It says that Renella is used to control phosphorus levels in, let me just read it this way. Renella, sevellum carbonate, is used to control phosphorus levels in adults and children 6 years of age and older with chronic kidney disease, right? And it's indicated for the control of serum phosphorus in patients with chronic kidney disease. All right, so, and as I said, this is an active form of vitamin D, and notice it says 1A-hydroxy-vitamin D3. That's what it says on the box, but I think it has some calcium in it as well, right? And so this is what they use to control your calcium levels, because if it's not controlled, then your parathyroid glands get overactive, and when that becomes overactive, your body starts seeping that calcium into your bones, and it's just this whole chaos, this chain effect that you don't want, right? So it's important to take these. One of the other things that I take is aroel. The drug name is irbesartan, right? And yes, I do know these drug names by heart, because sometimes something might come and I have to check, because if I'm used to getting this brand, sometimes you might go and be like, but that's not what I normally take. Check the drug name, because the drug name will tell you if it's the same thing, whether it's a different brand, yes or no. So here's another brand. It's the first time I'm seeing this one from NCRHA, but it's irbesartan. If you notice, part of it is covered, right? So this is the last one that I got. I had this before, because what I'll do is, remember that on dialysis days, depending on what our blood pressures are, we may not take blood pressure tablets. So you find that, especially with the blood pressure medication, you may have a little excess. So I had this from before, right? So it's important to take these things, because it's important to control the pressure. This is the aroel, the irbesartan, out of the pack, out of the box, out of this box. So let's look at the other one, because I haven't even opened it as yet. So I'll open it now. Right? So that's what they look like. This is the aroel brand, and this is whatever other new brand that I just got. It's important to take your medication, but it's also most important, it's more important for you to know the medication that you're taking, right? So like, there was a time in late 2021 into early 2022 where the hospital did not have this at all. Now, after having done my surgery, right, to get rid of that overactive thyroid glands, right, and I had to go and buy it. I bought it at Pennywise, I bought it at Super Farm, and the bottle is $300 plus for the bottle of 100. So it means that each tablet is $3 odd. But the thing is, so most of us, it may not be taking one, it might be 3, 4, 5, 6, 2, 3, 4, 5, 6 each day, right? So for now, I'm taking 3 per day, right? So a box may last 100 divided by 3. 3 is 9, so let's say about a month and 3 days, right? And that would take me to 99. So yes, so it's important to know, especially when you do your bloods, when you do your blood works, why don't you ask them to tell you what your HB level is, which is your hemoglobin level, which is your blood count. That's what we call your blood count. What is your blood count? What is your potassium level? Because that potassium, too high, too low, is problems with the heart. You have to constantly try to maintain this balance with your electrolytes. What is your phosphorus level, right? What is your clearance level when you do the dialysis? How many blood did you process? What's your KTV, which is potassium removed over the time that you do dialysis? Find out these things, because they are important. I can't stress it enough. Don't just collect the medication and sit and look at them. And if you take the medication and your blood pressure is too low, go back and see your doctor and explain. If you're taking the medication and your blood pressure is still high, go back and see your doctor and explain to them what's happening, right? If you're on 1-alpha and you find you're still getting a lot of pain all over your body, joint pain, go and see your doctor. Let them do the surgery done. They refuse to touch you without doing what they call a sesame scan. And guess what? At least when I did mine, it was not done in the hospital, so I had to do it privately. $3,000 to do a sesame scan. And that was 2021. Now it's 2023 post-COVID. Who knows what the cost of that is? $3,000 just to do. So you're paying a rent money, right? Because as I said, the average cost of rent in this country is $3,000. So you're paying rent money, or $500 almost, just to get a scan done to see where your parathyroid glands are and which ones are diseased, which ones are overactive, to determine if you need to remove all 4 or just 2 or just 1, right? Because you have 4 parathyroid glands which regulate your calcium, just as how your thyroid gland regulate your hormones. So it's important to take your medication. Take your medication. Check in with your doctor. Always have that doctor who you know you can rely on to be honest with you, and more importantly, tell you what the side effects of these things are and what's good for you. Know the difference between a calcium blocker. You have different kind of hypertensive medications, you know. You're right. You have angiotensin receptors. You have calcium blockers. You have beta blockers. You have different kind of medications that they use for different things depending on what's causing your blood pressure. Ask your doctor what is causing your high blood pressure. Find out, and then you'll know if the medication is right. Speak to your doctors. Don't be afraid. They're not gods. I promise you. I checked in with my doctors if they to see if they were gods, and I promise you they're not. You can talk to them. Whether they're used to it, yes or no, is none of your business. It's important for you to talk to them to find out what's going on with you. So, all right, take care, guys, and until the next one, just be good to yourself. All right. Got to be good to myself.